It's my pleasure to welcome back Dr. Isabel Mira from our Division of Pulmonary Medicine at Mayo Clinic in Florida to speak to us about a topic that is not often talked about but highly relevant to rheumatology, and that is pulmonary hypertension. Dr. Mira.
Thanks so much, and thanks to everybody for being here. Again, talking about pulmonary complications associated with autoimmune disease, and as Dr. Wen said, the pulmonary hypertension is a really important topic to recognize. It's complicated, requires like a multiple specialties to be involved. My goal is give a big picture and mostly give the message of how to recognize early on, because it's the only way that these patients can have better prognosis. So I will talk initially about how you define pulmonary hypertension. I will mention about how is the classification and when the connective tissue diseases are in that classification. And then basically topics or area about the Scleroderma, that is the main disease related with pulmonary hypertension between the connective tissue disorders. Then prevalence and incidence, risk factors and prognosis, and early detection, that again will be my main focus on the lecture, and something about treatment. Pulmonary hypertension is defined as the presence of mean pulmonary arterial pressure over 25 millimeters of mercury and wedge pressure less than 15 millimeters of mercury. These measurements are based on right heart catheterization. It's not based just on what happened in the echocardiogram, and that's the first message. Those patients require the heart catheterization to be diagnosed. I mentioned here the PVR of pulmonary vascular resistance, because in the last consensus was considered by some of the authors like should be in part of the definition, but really it's not necessary to have it. Some cases of pulmonary hypertension, like for instance, pulmonary hypertension, by physiology, liver patients are vasodilated, so the PVR is not really elevated on them all the time, so it's not really needed to have PVR over 3. But in our patients, in Scleroderma patients, basically, most of the time is elevated.